Well, I'm talking with Dr. Wilkinson. How are you?
Hi, Kelly. Doing great.
Great, at Wilkinson Dental. And today we're going to talk about Invisalign. How new is Invisalign?
Invisalign's been out for a few years. It's something that people are aware of. It's gotten better and better. There are a few other companies that do something similar, but Invisalign is the big name. And if you look into it at all, you'll find out that Invisalign has the best options for most patients. It provides the most custom mobility, I guess. That's a word.
Okay. All right. Now, do you do free consultations?
We do.
Okay.
Yes. If a person's interested in Invisalign, we want them to just come in. We want to get a good look at their situation, their desires. We'll take some pictures. We'll take some impressions of their teeth, make models. And that allows us then to input all that information into some very sophisticated software. It's that software that does all the magic for Invisalign.
Okay.
Because it allows you to preview and see what you're getting. And not everybody knows exactly what they want, but once you can see it, you can say, yes, that's the way I want my teeth to look.
So you work with the patient and they can give their input and
Yes.
you give yours, your professional input?
Exactly. And a lot of patients will just know the little thing that's bugging them, or sometimes there's a lot going on, but they can direct us to those things. We can make sure they get addressed, and then we can take it from the rest of the way and make sure that it gives them that kind of ideal smile.
Do you think that Invisalign was created because older adults wanted their teeth straightened and they didn't want to, have the big wire?
Exactly. I mean, the beauty of Invisalign is that it's virtually invisible. So I have a model here, and if you take that off of there.
That fits pretty tightly.
Yeah, it fits on snug. It's made perfectly to fit your mouth, so it's not going to fit on someone else.
Okay.
But this little clear plastic tray does all the work.
It's hard to believe that this would do the same thing as a wire.
Yeah. Well, with traditional wire braces, that wire is putting constant pressure on your teeth and trying to move them in a certain way. With these Invisalign trays, it's a series. So they're removable, and you'll wear each tray for about 2 weeks, and each one is moving very comfortably and gently the teeth slowly into the positions that you want. And that's all designed on a computer model that
It's perfect.
takes you from the beginning to the end.
Okay, so talk about food. How do you deal with food when you have Invisalign?
That's the beauty of these trays, is you take them out when you eat. So if you had conventional braces, you can't do that. You're dealing with cleaning all around the wires and brackets, flossing around it. With these, you can take them out to eat, take them out to brush and floss your teeth, and then put them back in.
How many hours a day do you need to wear them to get your optimal results?
Yeah, ideally you need to have them in 22, 23 hours a day. So you're really just taking...
No snacking?
You're just taking them out when you eat and when you clean and brush your teeth. It does rely on that constant, gentle pressure, and when not wearing them, then that lets off on that, and you won't get your results as fast as you want.
Okay, do you have a little bit of pain like the old braces?
Yeah, every time you switch out trays, there's just a little soreness because it's applying new pressure, but it's just for a day or so, and you're back on.
Now, what goes on? Do you apply something on the teeth before this goes on?
Generally, no. There's sometimes these little tiny buttons that go on certain teeth. They're clear, or they're tooth colored as well, so they're not really visible, but they allow you sometimes to do little torquing movements and to move teeth in a certain way. And those buttons are applied generally at the beginning, and then they're on there for the rest of the treatment, and then they're removed at the end.
All right, do you have a payment plan for those, or how does that work?
Yeah, we do. We have a lot of different options for paying for this treatment. We can get a lot of people started sometimes for nothing down, sometimes for $500 down. There's a lot of different options there for getting the treatment done. So we have great financial resources and a financial coordinator who is really dedicated to helping people get this treatment.
Okay, and one more question for you. Now, I guess just like other braces, it takes different amounts of time for different people?
It does. The average adult, I'd say on average, is about a year. There are some cases, a lot of people that choose to do it, it's because they had a relapse from original orthodontic treatment and things just shifted a little bit. They want to kind of get back where they were. Sometimes those can go even quicker, 5 or 6 months.
Dr. Wilkinson, tell us where you're located.
We are at 1902 East Battlefield, so right at the corner of Glenstone and Battlefield.
Okay, and you have a website?
Yes, it's wilkdental.com.
And a Facebook page.
Yes, we have a Facebook page, and we run specials on that page for Invisalign from time to time, so check us out.
All right, sounds good. If you guys are looking for a brighter, straighter smile, come in for a consultation at Wilkinson Dental. He's going to make you look better, and you're going to be happy you did.
Yeah.
All right, very good. Hey,
No
a
doubt.
big thanks to all of our guests, the Blue Bull Bar and Grill, Joe Patton with Missouri Farm Bureau Insurance, Brookline Station Trio, Big Brothers Big Sisters, Girls on the Run, and Wilkinson Dental. Have a great night, everyone, and we'll see you tomorrow. Thanks for watching.
And those empanadas rocked, I'm just saying.
Yeah.
Yes.